So yeah, thank you everybody again for coming and being a part of this talk and for listening to me today. So ti my presentation title here is "My Drinking Was Way Worse During the Pandemic: The Impacts of the COVID-19 Pandemic on Alcohol Use and Related Issues." Um, so before we begin, I just want to go over some disclosures and acknowledgments before we get started. So first off, I want to say that I and my colleagues have no financial conflicts of interest to disclose at this time. Um, I do want to acknowledge that this work is supported by um, grant funding from the National Institutes of Health, specifically the National Institutes of Alcoholism and Alcohol Abuse. And the the views expressed in this presentation are solely those of myself, and do not reflect the viewpoints and opinions of the NIH writ large. In terms of acknowledgements, first off, I would like to specifically acknowledge and thank the participants who were involved in this research. This work obviously wouldn't have been done without them, so I want to acknowledge that their time and effort was greatly appreciated, and we thank you for contributing to science. I'd also like to acknowledge the support staff at UC Berkeley and the Alcohol Research Group. Without their support, this work wouldn't have been able to be conducted, so I appreciate everyone in our admin team. And finally, I want to thank the scientists who are involved in this work and who continue to make strides to, address public health disparities in the field, specifically related to alcohol use. All right, so with that out of the way, I just want to jump into the presentation. So just a quick COVID-19 refresher. I was talking about this with my partner last night, and we were both saying how COVID-19 felt like it was like a lifetime ago, but it was really only a couple of years ago that the COVID-19 pandemic hit, even though it feels like for a lot of us, feels like it was much longer. Um, so with the COVID-19 pandemic, in terms of timelines, the first detected cases of COVID in the US were reported on in January of 2020, and then within a few months, the World Health Organization declared a global pandemic. That was March of 2020. This official pandemic emergency wasn't declared over until May of 2023, so just over 2 years ago. Um, and the COVID-19 pandemic had really wide-ranging impacts on a lot of people. Not just thinking about total confirmed cases, which was over 100 million in the US, and confirmed mortality due to COVID-19, which is well over a million deaths. The COVID-19 pandemic had far-reaching economic impacts for many in the US as well, including over $14 trillion estimated costs. Um, in addition to this, there's sort of incalculable psychological impacts of that, which we're still feeling the effects of to this day. Um, so, thinking about the COVID-19 pandemic, you may be asking, why alcohol? Like, what is COVID-19 and alcohol? Like, how are these related? Well, you know, looking at epidemiology, it's not unusual for alcohol use to increase at the population level in response to crises, like, for example, natural disasters or economic recessions or whatnot. But what we found here, and which I'll be talking about in more detail in a moment, is that COVID-19 was unique in a lot of ways. That is, particularly in the US, it was a confluence of both social, structural, and biological factors, which impacted not only impacted um, alcohol use at the individual level, but there were a lot of structural factors that impact alcohol use as well. So it was kind of like a perfect storm of factors that uniquely contributed to changes in alcohol use, which I'll be talking about in a moment. Um, so in terms of outline for our discussion today, so there are four key points that I'll be talking about. So I'll be talking a little bit about the methods overview for some of the research I'll be talking about. Um, I'll be talking about the specific COVID alcohol-related trends that we found. I'll be talking about what I call factors driving these trends. So these are factors that were associated with these changes in alcohol use. And then I'll close with conclusions and implications of this work, and then we'll open it up to a broader Q&A and just discussion. Um, so first, focusing on methods. So I want to take a moment to kind of go over some basic alcohol epidemiology, just so we're all on the same page. I understand this is a broad audience, just want to get some key terms out of the way so things are all clear. So when we talk about alcohol use in behavioral science and epidemiology, the unit of measurement we use in the US is the US standard drink. So this is just a standardized measure of alcohol use. So when we ask a person like how many drinks they had, we all know what a standard drink means. In this case, when a standard drink, for example, would be a 12-ounce beer, a 8 to 9 ounce malt liquor, a 5 ounce glass of wine, or a shot or 1.5 fluid ounce of spirits such as vodka, whiskey, what have you. Um, so here, here's when I put a little bit of quiz to the audience, just to get some engagement. So here we have on the left side of the screen, this is a list of drinking patterns that are commonly seen, or sorry, not commonly seen, that are commonly researched in alcohol epidemiology research and alcohol behavioral research. We have a list of definitions on the left side of the screen. And on the right side of the screen, we have terms that apply to these definitions. So here, what I'd like everyone to do is I would like you to give your answer in terms of how you think these definitions match. So you can see a poll on the screen right now. So for example, if you think that, um, for example, if you feel that item one, the fact or practice of restraining oneself from drinking alcohol, is if you whatever you feel that answer is, you can select it on the right side of your screen. So for example, if you think that's heavy drinking or binge drinking or abstention or whatnot, you just select your answer. And I'll give everyone roughly 30 or so seconds to do that. Okay, I think that's been about 30 seconds. Okay, everyone have their answers in?
Yeah, it looks like we have about 24 answers and there's 30 people right now.
Right.
So
All right, perfect. So,
let me end the poll.
gotcha. Thank you. All right, awesome. So, looks like we got some great responses. Okay, so here are the answers. So it looks like, so here, for example, these are different um, drinking patterns that we look at in alcohol epidemiology. So, for example, abstention is the fact or practice of restraining oneself from drinking alcohol. Moderate drinking is drinking up to one drink per day for cisgender females, up to 2 drinks per day for cisgender males. Binge drinking is drinking uh, 4 drinks per occasion for cisgender females, or more than 5 drinks per occasion for cisgender males. Heavy drinking is drinking 8 or more drinks per week for cisgender females and 15 or more drinks for cisgender males. And alcohol dependence is a cluster of behavioral, cognitive, and physiological phenomena that may develop after repeated alcohol use. I do want to point out that I'm using the Centers for Disease Control and Prevention definitions for moderate drinking and heavy drinking. There are slightly different definitions depending on the agency that you refer to. I believe NIAAA has a slightly different definition, but for parsimony, I'm using CDC. Um, okay, so that's one way we can measure alcohol use in epidemiology. We can look at behavioral patterns. Um, Another thing we can look at in alcohol epidemiology is individual level measurements. So, for example, we can look at quantity, the amount that someone drinks in a timeline, for example, like a day or a week or a month or what have you. We can look at frequency. This is, for example, the number of drinking occasions during a time frame. So, for example, during a week or a year or whatnot. And then we can look at intensity. When we say intensity, we're talking about the maximum number of drinks consumed during a single occasion per individual. And the reason we measure alcohol use in these different ways is because different drinking patterns and different drinking measurements have are associated with different health outcomes and also importantly vary across groups. So for example, there are notable differences in alcohol quantity and frequency, um, in between differences across sex and gender, as well as differences in age. And there are differences in race and ethnicity as well as income as well. So the point I'm trying to get across is that there are a lot of different ways you can measure alcohol. They all have different implications for scientific research as well as population tracking. So if we're looking at individual alcohol use, what about looking at population alcohol use? So if we're looking at alcohol at the population level, there's a few different ways we can measure this. So we can measure what's called per capita consumption. So for example, how much on average does someone drink or does a population drink? Um, we can look at patterns of drinking. So how do people drink? So for example, what context do they drink? What kinds of alcohol they drink, like who they're drinking with, that sort of things. Um, we can also look at distribution of consumption. So, for example, how much does a group on average drink? And we can also look at beverage preference. So, what kinds of alcohol are people drinking? Are they drinking beer? Are they drinking spirits? Are they drinking wine? What have you? Again, all these different outcomes are associated with different health outcomes. So we have a sense of how alcohol is measured. There are a lot of different ways or different surveys that have been done in the past to measure alcohol. So there are things, for example, like the Behavioral Factor Surveillance System, the BERFIS, and the National Alcohol Survey, the NAS, which I'll be talking about primarily today. These are semi-annual or biannual surveys that are conducted across the U.S. That measure alcohol use and substance use related patterns among different populations. These are generally done via individual interviews. So, for example, doing a web-based survey or in some cases a phone survey. They have transitioned away from in-person interviews, especially during the COVID years. It was done away with for the most part. I think some of them may continue those in the future, but generally they're not done in person at this point. Um, and also surveys like the National Survey on Drug Use and Health, the NISDA. Um, so I'm going to be focusing primarily on the National Alcohol Use Survey, the NAS. So this is just a timeline demonstrating kind of the history of the National Alcohol Survey. Obviously, I don't expect you to know this. It's just to kind of give you context. So the National Alcohol Survey um, is a national survey on alcohol and other substance use conducted by the Alcohol Research Group. This is a survey that's been done, I believe it says here in the 1970s, but it actually goes back a little bit further. I think to the late 50s, early 60s is when the NAS officially started. So we have roughly 45 years worth of alcohol data in the US that we were able to analyze and look at trends over time. So the goals of the NAS broadly are to get accurate estimates of alcohol use. Specifically, things like alcohol use prevalence, alcohol problems, and alcohol use disorder in the general population. The second goal of the NAS is to monitor trends and disparities. Like one of the things that the Alcohol Research Group is really interested in is monitoring trends, including disparities and prevalence of alcohol use um, over time. And finally, the third general goal is to examine risk relationships. And what I mean by that is relationships and mechanisms underlying alcohol use and problems and how those have changed over time. So, for example, how different factors might be related to different outcomes among different groups, like alcohol use risk may change and how negative health outcomes change across groups. So, for example, across gender identities or race and ethnicity, what have you. So having these data, we're able to look at how the U.S. population is changing its relationship with alcohol and the behavior with alcohol and other substance uses. So I'm sorry, and behavior with other alcohol and other substance use, like tobacco, cannabis, what have you. Um, so now that we have a general sense of how alcohol use is measured and like some of the different ways that we measure alcohol use, I want to talk a little bit about some of the specific things we found with our COVID data. Um, So I'll be focusing on primarily on the National Alcohol Survey COVID cohort. So this was a unique situation. So the Alcohol Research Group was in a unique position where we were conducting the 40th, we were conducting our 14th National Alcohol Survey right before the pandemic hit. So the data collection for the National Alcohol Survey was happening at the end of 2019 and data collection officially stopped right after the COVID-19 pandemic was declared, so around April 2020. So these are done in person, phone, and online surveys. We had a sample of roughly 6,500 participants looking at past year substance use and health related behaviors. So when the COVID-19 pandemic hit, ARG was able to quickly pivot to conduct a cohort study. So essentially, we were able to contact participants already in the National Alcohol Survey, and ask them if they want to participate in an additional 2 waves of data collection over the following 2 years. So this resulted in a cohort study of participants. We have alcohol data right before the pandemic hit, or at the very beginning of the pandemic, 1 year into the pandemic, and then 2 years into the pandemic, resulting in a sample of over 1,000 participants. Um, so that gives you a sense of like what the alcohol COVID cohort looked at. So we were looking at a few specific things with the alcohol COVID cohort. So we were interested in alcohol use, obviously. So specifically, we're looking at beverage specifics, for example, what kind of alcohol people were drinking, maybe how that changed since the pandemic started. We're also looking at alcohol availability, how the availability of alcohol changed as the pandemic unfolded. And I'll explain what I mean by that in a little bit. Um, we were also interested specifically in COVID impacts. We want to know a little bit more about how the context of the COVID-19 pandemic may have impacted people's substance use. So, for example, how issues related to COVID economic impacts may have impacted their alcohol use, as well as access to healthcare. And finally, we were interested in changes in alcohol motives. So we want to know a little bit about how people's alcohol use motivation changed due to the pandemic. So, for example, if the context of the pandemic impacted why they chose to drink or chose not to drink, for example. Um, so before we get into the details of the COVID impacts and the drinking motives, I want to talk a little bit about specific alcohol use changes we saw during the pandemic and how those varied across groups. So, looking across the COVID waves, we saw some notable changes in alcohol use over time. So specifically, we saw that for past year average number of drinks consumed, there were significant differences between groups. So for example, among self-identified Black or African American participants, we found a notable increase in average number of drinks between waves 1 and wave 2. So we can see that for our Black identified participants, the number of drinks they had increased dramatically between wave 1 and wave 2, but then decreased as the pandemic continued. Um, we also found that daily drinking changed among groups. So specifically among cisgender men, the number who reported daily drinking increased from 7.1% before the pandemic to 13.4% in wave 2. And you can see from this trend that while it did go down slightly towards the end of the pandemic, that number still remained elevated relative to pre-pandemic numbers. And if we look at daily drinking by age, we also found that relative to all their participants, those participants who were between the ages of 35 to 49 increased their daily drinking from 5.8% to 10.2% between waves 1 and 2. And again, we see that when with it and the 2 year point, that alcohol use is still elevated relative to pre-pandemic. We also saw differences by education. So specifically, daily drinking increased among individuals who reported some college use. So for example, those who had like 1 or 2 years of college. Um, Daily drinking also increased again there were differences by race and ethnicity. Specifically, we found that Black identified participants reported more daily drinking at wave 2 of the survey than wave 1. And again, this elevation did not seem to decrease 2 years in the pandemic. All right. So if we look, we also found differences in alcohol specific measures. So we found that spirits use increased among some participants. Specifically, those with some college education reported more use of spirits between waves 1 and 2 of the survey wave. We also found that Black identified participants reported more use of wine, a number of days specifically using wine, between waves 1 and wave 2. This number of days of wine use did go down at wave 3, but again was still elevated relative to time 1. And then if we look at our measure of hazardous alcohol use, that is drinking 8 or more drinks in a sitting, we actually found decreases, interestingly. So interestingly, hazardous alcohol use decreased among individuals with some college education between waves 1 and waves 2. It did rebound slightly at wave 3, but did not reach pre-pandemic levels. And then looking at alcohol use disorder symptom severity, we did see notable increases, specifically among people with high school education or less. So those who reported moderate to severe alcohol use disorder symptoms increased between waves one and wave three for those with high school education or less education. Um, okay, so that was a lot of information to give you all at once. So if you take nothing away from this presentation, the key points to keep in mind is that overall, what we found was that there were pretty significant changes in alcohol use in the US population, according to the National Alcohol Survey. Specifically, we found that spirits use, including frequency and volume, increased, daily drinking increased, and alcohol use disorder severity symptoms increased. Um, in addition, we found that with heavy drinking that there was actually some decrease in heavy alcohol use. Specifically, those reporting eight or more drinks per day went down, and then these measures stayed down at wave three, interestingly. But the key point, I think, one of the key points I want people to keep in mind is that these trends weren't the same across all groups. We found very notable differences across groups. Specifically, we're looking at race and ethnicity, we found that among Black identified participants, total alcohol volume increased between waves one and wave two, but seemed to get closer to pre-pandemic levels at wave three. However, there were some persistent differences at wave three relative to wave one, namely cisgender women, individuals aged 35 to 49, and those with high school education or less had persistently high alcohol use disorder symptoms at wave three. So all this is to say that we did see notable changes in alcohol use during the pandemic, and these changes fluctuated as the pandemic unfolded. But these differences weren't the same across groups. There were notable disparities that we found, specifically those related to race, ethnicity, gender, age, and education. So, okay, so we found those trends. We also found some pretty significant COVID economic impact. That is, we found that these changes in alcohol use were correlated with differences in economic hardships that were experienced by participants. So, analyses that I spearheaded with my colleagues recently, we were looking at what we called COVID economic impacts. By that, we're referring to financial economic outcomes directly related to the COVID-19 pandemic. For example, people losing their jobs, losing employment because of the pandemic. Our goal was we wanted to see how pre and early pandemic alcohol use and mental health impacted later COVID economic impacts. Um, so through marginal structural modeling, what we found was that pre-pandemic depression, anxiety increased economic hardships 2 years into the pandemic, but alcohol use didn't significantly predict these hardships. So what the takeaway from this is that um, those who are already vulnerable before the pandemic, i.e., those with mental health issues, seem to be especially sensitive to the potential economic impacts of COVID. Um, and that it might be if public health initiatives were done to improve access to mental health care, that could potentially help reduce economic consequences during future crises. We were also interested in looking at healthcare access and how that was tied to alcohol use during the pandemic. So another analysis spearheaded by my colleague, Dr. Nina Mulya, conducted research looking at general and behavioral healthcare access and disparities during the first year of the pandemic. So these researchers found that over almost 50% of those sampled who needed healthcare or wanted healthcare delayed care during the COVID-19 pandemic. And this makes sense. Like during the COVID-19 pandemic, healthcare workers were stretched extremely thin, so it makes sense that people were maybe delaying care when they needed it because it may have just been unavailable or just difficult to obtain. But importantly, it was found that those who were that participants who identified as Hispanic Latino or who came from lower income brackets were most likely to delay care. But in addition to that, these same participants who were more likely to delay care were also the highest to use telehealth and telehealth behavioral services for general and behavioral health care. And this is important because it suggests that telehealth could be a valuable tool to address health disparities. All right. So we've talked a lot about some of the trends we found with alcohol use and related health outcomes during the pandemic. Now I want to talk a little bit about could be potentially driving these trends. Like we know that alcohol use changed for a lot of people, and we know it changed differently across different populations, but this data can't really tell us the why necessarily. So I wanted to explore a little bit about like some of the research we've done, kind of exploring why some of these changes may have occurred. Before I do that, though, I'd like us to take a step back and kind of reflect on our experiences. Maybe to take like 30 to 60 seconds and we can think about the ways in which we were personally impacted by the pandemic, specifically our alcohol use. And I understand that, this might be a sensitive topic for individuals. So if you don't feel comfortable discussing that, that's totally fine. You don't have to share. Um, but I'd like us to just take a moment to kind of think about like how our own experiences were shaped by the pandemic. So for example, um, did anyone notice their alcohol use changed at all during the pandemic? For example, did you find you drank more? Did you feel you drank less? If so, what were some of the things that may have impacted that? Um, could it be changes in your work schedule? Could it be changes in to-go drinks or whatnot? So I'd like us all to just take a moment to think about it. And if you'd like, feel free to add your thoughts or reflections in the chat. Yep. Yeah, I'm definitely seeing some g great responses here. Yeah, wine moms was definitely a thing during the pandemic. I remember that. Mm, hmm. Yeah, I'm seeing a lot. I'm seeing a few responses talking about alcohol delivery, especially alcohol delivery, making it easier. Yep, that's definitely an experience. And I'll be actually talking about that in just a moment. Hmm. Yep, there were definitely some bars and breweries that didn't close. Yeah. Yeah, these are great. Like these are exact. I think these are phenomenal. Like exactly. This is an experience that a lot of people had. And and these anecdotal. Yep, yep, yep. These are fantastic. Thank you all for being forthcoming with your experiences. Um, these are exactly things that are reflected in our data, which I'll be talking about in just a second. Um, yeah. So when we're looking at alcohol driving, when we're looking at factors that drove some of these trends in alcohol use, there was a few things that emerged as we were looking through the data. The first one, which people were alluding to in the chat just a moment ago, is alcohol availability. So this was research spearheaded by my colleague, Dr. Trangenstein. Um, we wanted to look at how changes in alcohol availability were associated with changes in alcohol use. Specifically, there's two studies I want to talk about. The first one was conducted in 2023. The goal of this was to determine how population coverage of alcohol delivery and to go changed between December 2019 and December 2020. And in addition to that, they wanted to compare alcohol consumption patterns among persons who use these services and identify different demographic and behavioral characteristics that were associated with these use. So the specific alcohol delivery modalities they were looking at was to go and carry out policies, these were policies that allowed bars and restaurants to sell individual drinks for offsite consumption, and alcohol delivery, which is just having alcohol delivered to somebody's home through things like Grubhub or DoorDash, as people were talking about in the chat. So what this research found was that in the first year of the COVID-19 pandemic, the alcohol delivery services expanded extensively. So in the first year of the COVID-19 pandemic, 7.5% of US adults had alcohol delivered and 14.5% had bought alcohol to go. The number of people who lived in states that allowed these services rose pretty dramatically. So specifically, um, alcohol delivery rose by 284%, and that actually it rose even higher for to-go sales by it rose by over 600%. So to give you a sense of what that looks like, here are maps in the beginning of this study, right before the pandemic hit. These are states that allowed for um, to go and delivery of alcohol. And then roughly 1 year in, you can see how the number of states that allowed these policies exploded. Like I can tell you, for example, just speaking anecdotally, at the time I was living in Rhode Island, and Rhode Island's a unique state in that it has fairly restrictive alcohol policies, but it's still not a control state. Um, to the point where you can't actually buy like beer at the grocery store or whatnot. However, when the pandemic hit, all of a sudden you could have alcohol delivered to your house, which was very unusual. So the point I'm trying to make here is that the availability of alcohol really exploded during the COVID-19 pandemic, which not surprisingly had a relationship or had was associated with increases in alcohol use. Um, so when we're looking at behavioral and demographic characteristics that are associated with the use of these services during the pandemic, these researchers found that individuals who had more than or who had higher education, experienced COVID economic burdens, drank excessively previously to the pandemic, and lived in states that allowed for alcohol delivery were more likely to get alcohol delivered. In addition, people who lived in states that have alcohol to go sales were more likely to get these alcohol to go drinks. In addition, individuals were more likely to get alcohol to go drinks if they were 18 to 29, self-identifying as Black, and drank excessively prior to the pandemic. Um, and this graph just kind of gives a breakdown of the specific alcohol that was being delivered and to go. And you can see here a large percentage of that is wine consumption, kind of relating to what someone said in the chat earlier about wine culture or like wine moms being a big thing during the pandemic. Right. So this research also found, again, not surprisingly, that people who had alcohol delivered during the pandemic reported drinking 58% more drinks than those who did not have it delivered. Um, this was associated with more wine and spirits consumption during the first year of the pandemic. And this is relevant because the type of alcohol is important because these are drinks that have more alcohol than beer or other lighter, softer drinks. So people were not only drinking more, they were also drinking more alcohol. They were drinking beverages that had higher alcohol by volume than others. So we can see that changes in availability had a pretty big impact on alcohol use behavior. Um, so going along with that, the question that comes to my mind as I'm looking at these data is like, but why though? Like, okay, so we have change in availability change is being associated with alcohol use. That makes sense at its face value, like theoretically, if something's more available, people are more likely to use it. But that's not really getting at the why, in my opinion. Like, it's not getting at the motivation for drinking. It's not getting at kind of the individual level factors or individual level perceived factors that may be driving these trends. Um, so I want people to think about for a second, like, what do you think might have caused people to change some of the drinking? Like, even just because something's available doesn't mean someone's going to necessarily use it. There must be something else going on there that might be driving these trends in alcohol use. So it's not 100% known what those things are, but we've conducted some qualitative research that did shed some light on why alcohol use may have changed during the pandemic. So this qualitative research we conducted is part of a second part of the the National Alcohol Survey COVID cohort. This was an addendum qualitative study that we were conducted. So this research that was conducted by my mentor, Dr. Priscilla Martinez, the goal of this work was to qualitatively explore motivations for change in alcohol use during the pandemic. So we had a sample of 26 participants with which we conducted in-depth interviews, which lasted roughly an hour to an hour and a half. These were done over Zoom. During those interviews, we asked participants to talk about their alcohol use, how that changed during the pandemic, and their perceptions of why they think that changed. I should also note that these were participants who were all in each wave of the COVID cohort. So we have their quantitative alcohol data. So these are all participants who had reported increasing their alcohol use during the pandemic. So we know these are participants whose alcohol use kind of changed pretty dramatically over the course of the pandemic. Um, so we found some pretty interesting things when we were asking participants about their experiences. So we found that in terms of reasons for drinking, there were several major themes that arose. Um, the most One of the most prominent was drinking during the COVID-19 pandemic increased a number of participants because they had fewer barriers to their alcohol use than before. So, for example, this person was talking specifically about essentially not having the normal parameters that would curb his alcohol use normally. So in this case, this person was saying how, they were at home, they couldn't go to the gym, their work had basically stopped. They didn't have any kids or dependents. So for them, they were basically talking about how there just wasn't a reason for them to not drink when they wanted to. Um, Interestingly enough, this person also said later in the interview how they perceived the social norms around drinking to change during the pandemic. So they were talking how it seemed more socially acceptable amongst their friends to just drink during lunch, for example, or like just drink during the day. Like they were on a believe it was a Slack channel where they were just kind of just sharing pictures of their beers with one another. So the point I'm trying to get across here is that for a lot of participants, one of the reasons their alcohol use changed was there just was fewer barriers to drinking. Um, Along those same lines, another theme that was very prominent among participants was the increased availability of alcohol facilitating alcohol use. So this person was talking how in their state, they were in the southwest of the US, alcohol delivery had been approved by the governor, so it made it facilitated their use. It was much easier for them to obtain alcohol and therefore it increased their use. Um, Similarly, another theme that emerged was alcohol accessibility, and this kind of goes part and parcel with availability. So, with alcohol availability, we're talking about the ease with which someone can retain alcohol was increased. With accessibility, the alcohol the person had on hand was increased. So that is they're much more likely to have alcohol in their house or like in their fridge. And this person was talking specifically like how their wine rack was always full during the pandemic. Um, so we can see how availability of alcohol the increased availability of alcohol rather increased how accessible alcohol was and how that facilitated use. Um, Another theme that emerged was that a lot of participants described drinking alcohol as a means to escape chronic negative emotions, in this case, boredom. Um, so in a situation where they were feeling a lot of negative feelings, alcohol was one way for them to sort of give themselves a little treat or to feel that it was a way for them to emotionally regulate, essentially. Right. And then another reason that people described their alcohol increasing was kind of on the flip side, they wanted to use alcohol as a means to experience positive emotions. So, in a context in which these individuals were kind of isolated to home or isolated in their pods or what have you, they weren't able to go out, they weren't able to really do much else. So, alcohol was a way for them to regulate their emotions, not only to alleviate boredom and other negative emotions, but also to feel positive affect as well. Um, so we see this confluence of factors kind of increasing or contributing to people's potential increases in alcohol use. But on the flip side to that, we also had a number of participants who reported either not drinking or reducing their alcohol use pretty significantly over the course of the pandemic as it unfolded. Um, and one of the major themes that emerged was concerns about alcohol negatively impacting their health. So, for example, participants talked about how they had suffered from emotional issues before, and they realized the alcohol use was kind of exacerbating their mental health issues. Specifically, this person was talking about how they were experiencing depression as a result of the pandemic, and realized that while their alcohol use increased initially, that was actually exacerbating their mental health issues. So they actually decided to cut back as the pandemic unfolded. Um, Similarly, um, among some participants, a major theme that emerged was that a lot of people reduced their alcohol use because they were concerned that they were developing issues with alcohol use that they had seen in others, for example, their friends and family. So this person was talking about how their family had a history of substance use issues, and they were kind of noticing their own drinking becoming problematic, and they therefore curbed it. Um, Another theme that emerged was that life demands and transition kind of limited drinking opportunities. And what we mean by that is, for a number of participants, they were able to keep to a consistent routine, or they had other life obligations during the pandemic that prevented them from drinking. Um, so this person, for example, I believe he was an architect. I don't remember his exact profession, but he was able to work remotely, and because his work schedule didn't really change, he kind of developed his own rituals or basically daily routine which kind of curbed his use of alcohol. So um because he has a regimented routine, it actually was a protective factor against changing his alcohol use, or rather drinking excessively. Um, and then finally, um, the another factor that came up for a lot of participants was they reduced their alcohol use because they were concerned about the negative side effects or after effects of drinking. So, for example, this person was talking about their drinking that increased at the beginning of the pandemic. And then they noticed that this increase in alcohol use was affecting their work performance, so they decided to cut back. So all of this to say that for a lot of participants, there were actually quite a few reasons they chose not to drink or reduce their drinking, and these related to things like their routine, preventing them from engaging in alcohol use, as well as being concerned about some of the health effects of it. Okay. All right, so I've been talking for a while now, and I appreciate everyone's attention. So here, I just want to kind of take a moment to give some final parting, conclusions and implications of this work before we open it up to the larger questions and answers. So um, the basic take-home message from this talk today is, alcohol use increased for many in the U.S., but this wasn't uniform across all groups. We saw pretty significant differences across demographics, for example, race, ethnicity, age, and education status. We also found that these changes were associated with changes in economic outcomes, alcohol's availability and accessibility, as well as mental health. Um, so the implications for this work are pretty widespread. There are quite a few implications for this. So currently, we don't really know how alcohol may look. Let me rephrase this. Like, we've seen these changes in alcohol use during the pandemic. We're not clear on how these trends will continue over time. Because while many participants' alcohol use returned closer to their pre-pandemic levels, there's still many participants whose alcohol use did not. Um, and while we currently have conducted the most recent wave of the National Alcohol Survey earlier this year, those data are still being analyzed, so it's unclear how these trends will continue over time. But if I were to venture a guess, I would suspect that for many people, alcohol use that was changed during the pandemic will likely to continue to affect their life moving forward. But those data are still being collected, or I'm sorry, those data are still being analyzed, so we'll see. Kind of stay tuned for next steps. Um, second implication is support for future crises. Specifically, our work suggests that, some populations may be especially vulnerable to alcohol use changes during times of crises. So, for example, those who have pre-existing issues with mental health or those from marginalized social groups. Um, and along the same lines, alcohol screening is especially important. So, it may be a good idea for practitioners to continue to screen for alcohol use and potential issues, especially during times of crisis, for example, during economic crises. As we have seen, the alcohol use and economic crises are somewhat linked. Um, and not surprisingly, we found that alcohol availability impacted alcohol use. So advocating for potential third spaces and reducing access could be means to reduce use in the future. And I think one of the more important implications of this work is motivations for not using. So while many people did increase their use during the pandemic, there were quite a few people whose alcohol use either didn't change or went down. So I think it's really important um, to consider motivations for alcohol use and motivations specifically not for using alcohol in the future. It could be useful to explore with patients strategies that are meaningfully important to them and that could be useful for reducing their use if it's problematic. Okay. Um, so, I've been talking for a while now. I appreciate everyone's attention. So, what I'll do now is I will stop presenting for a moment and I'll just open the floor up for a general discussion and Q&A.
If anyone has any questions or comments, you can put them in the chat, or you can also raise your hand and we can unmute you.
Okay. All right. So I see a question in the chat here. Do we have any data on polysubstance use in addition to alcohol during the pandemic? So the answer is yes. We do have use. We do have some data on polysubstance use. I wasn't involved in those analyses, so I'm not quite sure what they found. But yeah, so that has been something that's been looked at. We do have data on polysubstance use. Gotcha. Okay, so I see a question in the chat here. Do the work include youth use? That's a really excellent question. So unfortunately for these data, the National Alcohol Survey is looking specifically at adults in the US, so 18 years of age or older. I'm trying to recall, I believe there has been some work done using, I'm trying to think off the top of my head. So I believe the Burfus has examined substance use among minors. The Monitoring the Future study, I'm not sure, which is looking specifically at college students. Might have done. I'm not. Might have done some work on this as well. Unfortunately, these data don't look specifically at youth use. Yes. Oh,
Hi,
thanks.
Anthony, can you hear me?
Yep, I can hear you.
Hi, I'm Cynthia. I'm with Say San Diego. Thanks again for your presentation. Super interesting. So, do you feel, just with your expertise and knowledge in this area, with more adults consuming alcohol during that time period, that youth access and subsequent use would have increased during that time? And if so, to what extent, just with your knowledge on the topic?
Yeah, that's a really interesting question. So, so it's challenging for me to say because I don't want to. Let me. How do I phrase this? Like, because I don't look specific. Because these data haven't looked specifically at youth use, it's challenging to say. That being said, I would think that there may have been some changes in youth use. I can speak sort of anecdotally that during the qualitative interviews, specifically participants who had children talked a lot about how they had kind of increased the challenges of parenting with their children, and how
Mhm.
alcohol use kind of exacerbated that. So, for example, one participant was talking about how because their alcohol use had increased, they had a harder time taking care of their children. Um, they didn't specifically talk about about youth using alcohol or other substances. Um, but they did talk a lot about kind of the mental health issues their children were facing. So another participant was talking about how their children were in high school at the time,
Mhm.
and because of the pandemic, they essentially were experiencing pretty severe depressive episodes.
Mhm.
I don't think it would be beyond. I don't think it'd be beyond the realm of possibility that alcohol use may have changed among youth, especially if there's increased availability and accessibility of alcohol. Like if, for example, their parents have had alcohol delivered or have increased access to alcohol, I could see it possibly impacting the use. Um, that would be kind of my assumption or my kind of guess, but unfortunately, I can't provide tangible data if that's helpful. So,
Got it. Thank you. And for the alcohol delivery, was it always to, I mean, obviously somebody over at the age of 21,
mhm.
but was there regulations in place about like checking ID and making sure that the
Hmm.
person who was receiving the package was of age? Or is that something that, where they just left it at the door because it was,
Hmm.
the pandemic and 6 feet and everything?
Yeah, that's an excellent question. So the short answer is yes, but the longer answer is it depends.
Mm.
So the thing about the US is unlike other countries, alcohol control policies vary extremely widely across jurisdictions. So I kind of alluded to this earlier, but um, in many states, alcohol use is more tightly controlled than other states. So there are some, and this is something that we weren't really able to account for this in these specific analyses, just because the granularity would be such that there'd be no statistical power essentially. But basically, to answer your question, there are laws in place that require individuals actually receiving the alcohol to be present, like be in person or to show ID in some capacity, but that varies from state to state. So some places that was the case, some places that wasn't. It wasn't something able to necessarily account for in statistical modeling, again, just due to power issues.
Mhm.
But the control policies varied so widely that there were some cases where that was the case. There were some instances where that was the case, or some contexts where that was the case, others where it was not, if that answers your question. So,
It does. Thank you very much. And thanks again for
mhm.
being here.
Oh yeah, of course. Thank you. Um, I believe
It
the
looks
question.
like, yeah, there's another question in the chat. I just wanted
Mhm.
to make sure we didn't miss it. Says, with the results of the survey, were there any that could be geo-targeted for use with heat mapping?
Uh, with the results. Oh, okay. So yes, so we have done some multi-level modeling. So specifically, we've done some modeling where we look at participants nested within different regions, kind of how that associated with their alcohol use. So uh, we didn't specifically find differences between states that may have been a power issue, we were able to do some geocoding. I believe that my colleagues are working on some analyses looking specifically at that. I think there's another question in the chat. Do you have information on drinking during the pandemic and its impact on the LGBT community? Um, so that's a great question. Short answer is there is some data that suggests that the LGBT community was differentially impacted by the pandemic regarding alcohol use. So this isn't research that I've done specifically, I can't speak to the details of that research, but there is some research suggesting that within the LGBT community, specifically gender minoritized individuals, e.g., people who are transgender, non-binary, or whatnot, may have been, they may have engaged in more substance use, specifically alcohol. Don't know the details of that research, but that is some of the evidence that I've seen. This particular research didn't have a large enough sample of LGBTQ plus individuals to do sort of more granular research on that. But to answer your initial question, there is some evidence to suggest that drinking during the pandemic may have increased among LGBTQ plus individuals. Yeah.
It looks like we have one more question and it didn't go in the chat. It went in the question portion.
Mhm.
Brian is said, thank you for your presentation. How can we explain that wine was really the beverage that saw the most notable spike in these waves? Commercial advertising, question mark, availability, culture exposure, or idealization for drinking wine?
Yeah, so that's a really great question. So I think it's a lot of different factors. So I think it might be a matter of one, there has been a general trend in the U.S. over the past few years, away from beer consumption. So this is research that that my colleague Dr. William Kerr has done. There seems to be some, speaking generally, the general U.S. population, there's some evidence suggests that people are drinking less beer just in general, and moving more towards wine and other alcohol beverages, um, like spirits specifically, particularly with the increase in things like White Claw, which is vodka, I believe. There seems to be a general trend away from beer consumption and more towards liquor or harder spirits, let's say, and towards wine. So that's part of it. That was a general trend before the pandemic that people seem to be drinking less beer. Um, in regards to other factors, there is also some evidence that the marketing of alcohol is skewing more towards promoting wine for some populations, like the wine mom phenomenon. Not my colleague. I know that Catherine Keyes, who's at Columbia University, has studied pretty extensively changes in alcohol trends over the past several years among women specifically. Her research suggests that the gender gap in alcohol use seems to be closing. This is a slightly different topic, but it's related. So Catherine Key's work out of Columbia suggests that cisgender women specifically, are not necessarily drinking more alcohol than men. It's more that the general trend has been men have been drinking less alcohol, whereas women's alcohol use has kind of remained relatively stable. So so what we used to see is that the difference between general population cisgender men and women's alcohol use was pretty starkly different, but that's kind of changing. They're getting much closer. Um, that might also be part of it, is like wine use might be increasing among different populations. So that might explain. Um, why there's been this trend of more wine use. I'm not, does that, I believe that, does that answer the question? Let me know if that's not answering it.